My name is Nithya Dhanraj, and my partner Emily and I, for the course of this summer, worked in partnership with the Camden Coalition to create a feasibility study in which we would determine and identify various different community partners who would become a part of our Bridging the Gaps program in our medical school.
Our primary community partner was the Camden Coalition, whose goal is to overall improve community health through the field of complex care. And they do this on various levels. On an individual level, they identify patients who use the healthcare system a lot and intervene through navigation. And this includes medical navigation and also housing and other resources to decrease the number of hospital visits. On a local level, they screen for social determinants of health in many clinical locations, and they also gather information about different clinical locations to strategize ways to improve quality and continuity of care. Finally, on a national level, the Camden Coalition is an advocate for policies about health equity, and they aid partners across the country to help develop similar models. So the goal of our project, as Nithya said, was to establish the feasibility of hosting Bridging the Gaps in Camden. So we connected with different community-based organizations, primarily through the Camden Coalition, and we asked them different questions about our partnership, such as how they would mentor students, how their organization functions within the Camden community. And then our final project, we wrote up a feasibility study to be presented to Cooper University Hospital and Cooper Medical School of Rowan University, our institution, proposing a new Bridging the Gaps program. For our results, we learned a lot more about healthcare accessibility, social determinants of health, and advocacy through our partnership with the Camden Coalition. And we were also able to establish relationships with 10 community-based organizations in Camden. And this map shows the location of those community organizations, with the home bases being Cooper Medical School and the Camden Coalition. We're also developing the feasibility report as stated, and this will include a vision for the structure of Bridging the Gaps within our school, plans for funding, plans for student engagement, how to get people involved with Bridging the Gaps, our long-term vision and expansion of the program within our institution, and profiles of these community health partners that we want to partner with.
The Camden Coalition was an excellent community partner to work with over the course of the summer. Their knowledge of the needs of the Camden community is almost unmatched compared to other similar organizations. Not only does their passion for service shine through in all of their endeavors, but they were also excellent mentors to Emily and I, and were instrumental in introducing us to the various community partners, which we will incorporate into our CMSRU Bridging the Gaps program. The mission of Bridging the Gaps aligns itself with many of the goals of CMSRU, which is why the program would be an asset to our medical school. In particular, the Wednesday seminar sessions were very impactful as we were able to hear from many passionate speakers about a variety of topics that sparked meaningful discussions among our peers. The future partnership between CMSRU and Bridging the Gaps would be very beneficial to our medical school, as it would provide a way for students to spend their summers in a meaningful way connecting with the community, which is a very important part of our curriculum. Additionally, with this new partnership, the more connections we make with the organizations in Camden, the more entrenched CMSRU becomes in the Camden community.